reporting for FYI Diabetes. I'm here at the Faustman lab with Dr. Denise Faustman, who is developing a cure for type 1 diabetes. Now, last year you shared your results from the phase 1 human clinical trials, and we discussed the beginning of phase 2. So how are the phase 2 studies going, and what makes this trial unique?
Okay, so 2 questions. We're actively enrolling in the phase 2 trial right now. The phase 2 trial involves 150 long-term type 1 diabetics, and we're, as of today, about halfway enrolled. So about 75 people have already consented and started the vaccination program. And so over the next year, we hope to enroll the next 75 long-term diabetics. Your second question is a good one. Why is this trial unique? This is one of the first immune intervention trials in the world of using a 100-year-old vaccine, so impeccably safe. And it's a trial that's also unique in trying to reverse diabetes in people who already have long-standing disease. So these are not trials in new onset diabetics defined as your blood sugar went up a month ago, your blood sugar went up 3 months ago, your blood sugar went up a year ago. These are people 15 to 20 years out from diabetes. And then the third thing that's truly unique about these advanced clinical trials is that these are nonprofit trials. So these are totally supported by philanthropic donations.
So what is the time frame for phase 2, and do you see a phase 3 in the future?
Yes. Okay, so the phase 2 trial is a long trial. It's 5 years long, and there's a very good reason for making this trial 5 years long, and that is when you look at the global trials going on in autoimmunity and BCG, the true clinical effects of repeat BCG vaccine are showing improvement in multiple autoimmune diseases with monitoring the patients for the clinical endpoints over a 5-year time period. So we're telling everybody, be patient. This is not an immunosuppressive drug that's taking away all your T cells in 2 weeks, but this is really changing your metabolism permanently. So we hope to be able to duplicate the data in phase 1 and do it gradually over the 5-year period.
So are you still enrolling patients for phase 2?
Yeah.
And if so, what type of patient characteristics are you looking for?
So we're still enrolling, so if you're interested, you can go to diabetestrials.org or faustmanlab.org and fill out a registration sheet. We're always interested in everybody registering because although I'm going to talk in a minute about who we're registering now, it could be a year from now we're registering a different type of type 1 diabetic. So it's good to have your clinical information in our database because then we can reach out to you if your characteristics fit. For this particular trial, the traits of these people are people that have had long-standing type 1 diabetes, so it could be 5 years, it could be 10 years, it could be 15 years, or it could be 20 years. They also, these people that are long-standing diabetics have a small amount of residual C-peptide from their pancreas. It means their pancreas is still making a little bit of insulin. And to find out if their pancreas is making any insulin, they have to come visit us because we have very, very sensitive assays to look for that residual C-peptide. Also, patients cannot have any diabetic complications yet, whether it's their eyes or their kidneys or their feet. And also, it requires people who are really dedicated that are willing to visit us frequently over the next 5 years. And the other thing everybody always asks me are like, why aren't you doing kids? Or they people want to be in the trial and they don't have any pancreas function left. It doesn't mean that we don't think this drug is going to work in little kids with new onset diabetes. And it's not that we think this drug won't work in somebody who's had it for 30 years, but we need to match the patient population that we used in phase 1 with phase 2 so we can use both sets of data as we try for drug approval.
Okay, so how safe is the BCG vaccine?
Yeah.
Are there any side effects that you know of?
Yes. So that's kind of the fun thing about this program. So unlike most drug development where you've got something new and maybe it's been tested in 50 people in a phase 1 trial and some primates before it went into humans, this is a 100-year-old vaccine. And to date, globally, it's been the most continuously used vaccine in the history of the world. It was developed over 100 years ago as a vaccine to prevent tuberculosis. And currently, on an annual basis, over 100 million newborns get vaccinated with this vaccine globally. So we know more about this vaccine than any drug you can get at the prescription counter of CVS or Rite Aid. This drug, if you looked at your annual flu vaccine, the counterindications, it's the same counterindications for this drug. If you're pregnant, if you're immunosuppressed, if you have AIDS, if you are living with somebody immunosuppressed, you wouldn't take this vaccine. But everybody else, just like the flu vaccine, can usually take this vaccine.
So there are no age limitations after the trials are complete?
Yeah. So for this trial, this particular phase 2 trial, we certainly have age ranges. Okay, you have to be over 18 because you have to be able to consent, and I think you have to be under 65. So that's our range. But if we get it approved, there'll probably be more flexibility in those age ranges, and certainly people want to do trials in kids as well.
Okay. So what is the worldwide enthusiasm on the BCG vaccine?
Yeah, so it's kind of interesting. So we were kind of lonely for a while, about 10 years ago, and we were lonely because this reuse of the BCG vaccine was kind of a unique idea to take a generic drug and recycle it. But now globally, there's over 9 clinical trials in autoimmunity and allergy going on, all within academic centers of people starting to see that, oh wow, this could be highly effective. So the most advanced trials globally right now are in multiple sclerosis in Italy, and they're starting phase 3 trials. So it's truly remarkable where the world has taken us over the last 5-7 years with respect to BCG.
Well, I cannot thank you enough for everything that you've done. I, along with millions of other people, are extremely grateful and can't wait for the results of phase 2. And thank you and your team for your continued efforts to cure type 1 diabetes. And thank you for taking the time to answer all of our questions today.
Well, you're very welcome. And just so everybody knows who's listening to the video, we wouldn't be here without the public support.
Yes.
Because most trials at this stage are uniformly supported by the pharmaceutical industry, and we have the unique distinction of being supported by the public. So we thank you very much for your donations.
Yes, and if you guys would like to support Dr. Faustman in her efforts, you can visit thefaustmanlab.org and just follow the link below to make a donation. Thank you.